Hi everyone, my name is Maria Teresa Ferretti. I'm the co-founder and chief scientific officer of a nonprofit organization called Women's Brain Project, which studies sex and gender determinants to brain and mental health as the gateway to precision medicine. It is my pleasure to be here with you today and to be in a conversation with Dr. Carmela Tartaglia. Carmela is a Women's Brain Project collaborator. She is a cognitive neurologist at the University Health Network and an associate professor at the University of Toronto. Hi, Carmela. So let's talk for a second about the role of the caregivers and how maybe sex and gender might have an impact there as well. Do you think there are differences between men and women being caregivers, maybe also related to gender stereotypes?
Yes, there are important differences towards caregivers that are impacted by sex and gender. So as we've mentioned, women tend to be the caregivers in dementia. And that is both young women as well as in older women. And you could imagine that, the societal and cultural stereotypes that exist will have an impact. Firstly, women tend to take on these caregiving roles and will often not ask for help, because they feel that it is their obligation to be doing this role. In addition, because of differences in our personalities, in the way that we interact with the world, the social isolation that comes on with caregiving might have a different impact on males and females. The needs of the caregivers could be very different. For example, in terms of males taking the caregiving roles, we might have to give cooking lessons in many cases. In females, we have other needs that are required. So you need to have precision medicine both with the patient as well as with the caregiver.
So if you wanted to give the most important message that people should keep from this conversation we had, what do you think is the most important one? And really, in general, from your perspective as a specialist, as a neurologist, why do you think considering and having more awareness of these sex and gender differences is important in the diagnosis of Alzheimer's disease?
So the journey of the patient with dementia and their family is a complex one. And the healthcare system, both for diagnosis, for follow-up, for caregiving, needs to be personalized. So in the short term, we want more awareness and interest in screening and early diagnosis for both males and females, as well as the understanding that there's going to be different diagnostic challenges for males and females. And we need precision medicine, personalized medicine in neurodegenerative disease, just like in other diseases. In the longer term, obviously we want clinical and societal integration of sex and gender needs in all levels. And so we want sex-adjusted scales. We want biomarkers to be sex-adjusted. We want to think about the specific needs of females as well as male caregivers. This could translate into novel clinical trial designs that would better identify responders, that would better identify the sex-specific side effects, so that we could end up with personalized medicine in the neurodegenerative diseases.